I went to medical school at Johns Hopkins University School of Medicine, and my problem was I liked everything. I liked all specialties, so I didn't know what I wanted to do. And I chose plastic surgery because I can operate on adults, elderly, children, and people within a few hours are better.
I went to school at NYU where I started out as a major in theater, and I was in the School of the Arts. And I lasted there for about a year or two and then became pre-med. While I was in medical school, what appealed to me the most was surgery. Plastic surgery for me became very interesting because you can operate on anything from the head to the toe. Everything on the human body is considered plastic surgery expertise.
What I like most about Nyack Hospital is I'm able to work with some of the finest physicians in the country here. At the same time, I have a hospital that's always striving to be better.
I originally came to Nyack Hospital to join Dr. Martha McGuffey. I was a resident up at Yale, and I was starting to look for a job. And I came here to Nyack Hospital, and I made rounds with her, and I spent some time with her, and I was smitten. The Hudson Valley was beautiful, the hospital was friendly, Dr. McGuffey and I were just two peas in a pod, and I've been here for about 25 years.
Well, basically on my off time, I like to play tennis, I like to hike, I like to bike, I like to kayak, and I like to swim.
A perfect day off. Well, first I would sleep late, get up on a beautiful sunny day, jump on my motorcycle, ride it down to my boat, and spend the day on the boat.
My philosophy is really very easy. I treat my patients the way I want to be treated and the way I want my family to be treated.
When I meet a patient for the first time, or when I think about how I like to run my doctor-patient relationship, I try to keep it very professional but very comfortable. I don't mind if they call me by my first name. I try to reduce the level of anxiety for the patient.
Sometimes when I'm out in the community, you could be anywhere, and as soon as people find out you're a plastic surgeon, they want to ask you something. They said, "Oh, I need you."
Well, I think there's a large misconception in the community of the world what plastic surgery is. And plastic surgery really is not fancy surgery to the stars. The majority of what we do as plastic surgeons is restoring the face, the body, to something that we would consider normal. And it doesn't necessarily mean that we're making it beautiful or that we're doing cosmetic surgery in Hollywood. Plastic surgery really is more of reconstruction and more of restoration, if you will, rather than cosmetic work.